Recording in progress.
Medical Coders, if you are one of those who says that AI can't do what I do, I hope you'll pay attention for just a few minutes and hear me out on what I have to share with you. And in the meantime, I hope that we thank you for watching. Don't forget to like, comment, and share this video if you feel it is beneficial to you. I want to take a step back in time to the year 2011, where I was interviewed by a consulting company. Okay, and I want to take a look at a specific question. The question was, do you think computer-assisted coding will ever take the place of coders? Okay, now if that question were asked today, the term AI would be involved in that question. All right. At the time, AI was not, I mean, maybe some technical people deep in the bowels of, the IT industry might have used the word AI, but it would have still been in its infantile stages. The common, the common folks just didn't, AI was not a word or a term that was in our vocabulary. So again, at the time, do you think computer-assisted coding will ever take the place of coders? And my answer was absolutely not. At least not as long as the coding methodology is as it is now. I've actually worked with a number of these systems, and there are too many areas where context is involved, and these systems are yet to be able to accurately and reliably handle context. If that hurdle is ever solved, then perhaps. But until then, I cannot envision this being nearly as reliable as the human element. So again, that was me, Doug Palmer, in 2011, answering a question about CAC, computer-assisted coding. And here's my answer. And the critical part of this is context. I had the vision and the foresight at that time to say the challenge is context. Well, me, Doug Palmer, in 2024, actually now says I've actually worked with a number of these systems and many advances have been made. This includes large language model and generative AI that allows AI to perform some highly advanced functions, including context. Let's take a look at a quick example. All right, and this has nothing to do with coding, but I'm going to ask ChatGPT to describe all the numerical references in a sentence. John Smith III was the first member of the $1 million club in the year 2023. Okay, and ChatGPT is answering the question exactly as I asked it from the information and explaining the answer. Okay. But it did miss one. And so I kind of asked, well, did you miss anything? And it went back, it looked at its answer, and it learned. It corrected its mistake. Okay. And this is really, really, really important, folks, to understand that the difference of AI to, technology that you may be familiar with, search engines, etc., and the ability of AI to grow and learn new parameters as it goes. So now let's take another look. So let's take a quick look at what AI can do. So we're going to ask it a quick question. We are going to ask about guidelines, what instruction is given in ICD-10-CM official guidelines in regard to sequencing obstetrical ICD-10-CM codes. Let's find out what it says. And so it understands the question and it provides some pretty detailed answer. So this is a combination of a large language model and generative AI. Okay, so if you believe that AI can't do what you do, you may want to explore that just a little bit further. So now let's just take another example, and we are going to ask it, so if a pregnant woman has diabetes and is pregnant, if a pregnant woman has diabetes, so if a woman is pregnant and if a woman has diabetes and is pregnant, how would the code be assigned? Let's see what it says. Okay, so it understood the question, and it says the primary code from chapter 15 would be the primary code. Okay, so what I want to emphasize here is that this is not a search engine. You know, this is not where it matches a key term. AI can understand context. And when I say understand, it can handle context, and it can respond in context. So again, this is off-the-shelf, publicly available AI. What is really important to understand is that the many, many AI vendors out there currently marketing to healthcare organizations have gone to great time, great labor, great expense to further this to healthcare. So for those of you who think that AI is simply Gemini or ChatGPT, you know, you probably want to rethink that a little bit. You know, some of the biggest names in healthcare as far as data management and coding have spent a great amount of resources to build AI for autonomous coding. Okay. And again, I want to stress that autonomous coding is not going to eliminate medical coders. It is going to change roles. It is going to change how medical coders do their work and what they do. So it is not something that you should panic about. It's something that you should prepare for. Again, so let's take a look at the two categories here: autonomous medical coding and human medical coders. The future is the present. And if you visit our website, link in the description, we have all these links to, you know, two major EMRs, and it's not to say other EMRs, don't also incorporate or integrate AI. And there's 15, almost 20 AI vendors, and you can click on each of these. Again, the link to our website is in the description. You can go and you can click on these links, and you can see what these AI vendors are offering. And you will see consistently no human needed, accuracy, quality, all of these different things. Okay, at least those are what they claim. And so one thing that's very important is AI is not flawless. AI does not always get it right. And we're going to look at that in a moment. But what is very important for coders to understand is roles are changing as a result of technology. And if you don't prepare, you will not be prepared for when your role changes. And changes can happen rapidly. And if you are not prepared, employers may seek those who are. Let's look at an employment listing of the future, but now. Medical coder with autonomous coding review experience. Okay. And this means that, you are not in this role, you may not be assigning the codes. Autonomous coding will be doing that. You will be responsible for assuring that the autonomous coding has it right. And you can only do that if you have the solid foundation to identify when coding is correct or when it is not. Okay, and this leads to, the selling point for autonomous medical coding to healthcare organizations is based on these 6 factors: quality, accuracy, efficiency, ROI, which is return on investment, scalability, and compliance. Okay. And so the medical coder is is moving from the action of assigning codes to the action of reviewing the output from autonomous coding for quality, for accuracy, and for compliance. Okay, and this is going to take place in all healthcare organizations, big facilities like hospitals, and and medical practices, and everywhere healthcare uses coding. Now, something to remember is compliance responsibility is still going to be with the organization. The organization that is submitting claims cannot subrogate, cannot say, oh, well, it's the AI vendor's fault that it was wrong. No. The billing provider is still ultimately responsible for compliance. And so they are going to need coders who can review the autonomous coding and make sure that it is right. So this is the new role of medical coders. Okay. And I urge you to be prepared, get prepared, be proactive, not reactive. And so you'll want to strengthen your skills across, many areas, develop new areas so that you can be strong in, and reinforce the areas that you do code in. So if you're an E&M coder, you want to strengthen your E&M. But a number of these different areas, such as wound repair. What do we deal with in wound repair? Length, anatomical location, complexity, right? Radiology, we might, 1, 2, 3 views with or without contrast. Any of these coding scenarios are areas where you want to make sure that you understand the full process of that code assignment so that you can overview the autonomous coding output. So you need to strengthen your skills. So again, medical coders are going to be coding less and less, and they are going to be applying their skills in a different way, in a different role. I want to take E&M. We're going to look at an example here in a moment, okay? But let's take E&M. So I showed you how large language model and generative AI can answer specific questions. And this is why people say, oh, AI can't do what I do. There's too many different data points that I have to go look at that AI can't. If you believe that, I urge you to rethink it because it can, okay? And I think, the simple examples that I've shown from just a straight off-the-shelf, commercially available on the internet AI processing has demonstrated that to a degree. And then when you add all of the behind-the-scenes development that healthcare-specific AI developers and autonomous coding developers are adding algorithms and different layers and different neural networks, believe me, they can. So we're going to look at two E&Ms here, okay? And of course, we have time at the bottom, but to level an E&M, we concentrate on 3 different elements: number and complexity of problems addressed, amount and complexity of data to be reviewed, and risk, the table of risk. So let's take a quick look at, I want to take a quick look at 2 charts, okay? So give me a moment. Okay, and let me pump the zoom up here a little bit. This is John Doe, and John Doe is here for follow-up diabetes, hypertension, hyperlipidemia. The provider notes that they are all stable. He ordered an A1C and a lipid panel, and the assessment is diabetes, hypertension, hyperlipidemia. The plan is continue present medications. Okay. Now, if we go back to number and complexity of, number of problems addressed. Okay, there were 3 problems addressed here. Okay, they were all addressed. Diabetes is stable, hypertension is stable, hyperlipidemia is stable. There was a lab ordered for the diabetes. There was a lab ordered for the hyperlipidemia, and so there were 3 problems addressed. Okay, so if you look at, if you're familiar with that category, we reach a certain level for that. Amount and complexity of data, we have 2 independent labs ordered. So we would mark that down in that category. And then under the table of risk, continue present medications. And we have a separate video that you can look at. Continue present medications qualifies for prescription drug management according to all CMS MACs. And so that would be moderate moderate risk. And so the provider coded 99214. So now let's see how AI handled this record. Okay. And this is an autonomous coding vendor who's out there marketing to healthcare organizations, and it identified the 3 diagnoses. It identified a 99214. Okay, and it got this one correct. Okay, now let's look at Jane Doe. Okay, and again, let me enlarge this a little bit. Jane Doe, patient here to review test results with doctor. Reviewed and discussed vitamin D, WNL within normal limits, but no lower limits of normality. Patient is feeling good. Okay. And so we got some surgical history. We've got vitals. There was no exam done here. Okay. Likely because the patient just came in to review lab results. Now look at this assessment. Okay. There are, I believe there's 19 diagnoses here in the assessment. Okay. And here is why you need to make sure that you are an expert in E&M, because the provider code, this is 99214. Okay. And we're going to actually show you, and I'm going to play spoiler here. Okay. You will see that autonomous coding coded as a 99214. Okay. But let's look at number and complexity of problems addressed. There was really not a problem addressed. Okay, so this is the lowest level in the first section. There were no amount and complexity of data. There was no labs ordered or reviewed. Okay, or you could say there was one if you wanted to say vitamin D within normal limits. All right, and none of these diagnoses, okay, it was addressed in this encounter, and so there's minimal to none in the table of risk. Okay, this is a 99212 at best. So the provider coded as a 99214, AI coded it as a 99214. Okay, and none of these diagnoses were addressed in the encounter, and so they are certainly not, they're not reportable. Okay, and so this is where a medical coder is now, they're not assigning the codes, but they are assuring that the output from autonomous coding is correct. Okay, so this is the important part for medical coders to wrap their brain around and understand their future career role. Okay, and if you don't prepare for that, somebody else will be when opportunity presents itself. Okay, and so it doesn't matter what area of coding you work in, whether it's, and it doesn't matter what what area of coding, it could be surgery, it could be lab and pathology, it could be radiology, minor op procedures, inpatient, ED, you have to be strong enough in your coding area to be able not just to assign codes, but to determine whether coding done by autonomous coding is accurate. Okay, so I just want to reiterate at the point of being repetitious. Autonomous medical coding is here. remember to go to our website. Remember to look at the many, many vendors that are out there, and more are entering the market every day. They've doubled in the last 6 months. Human medical coders are going to be coding less and less. They are going to be reviewing the output of autonomous medical coding, and that is the future of medical coders. So please visit our website. Please look at some of the resources. Please look at what we offer to help you move to the future, which is truly the present. Thank you, everybody. And again, if you like this video, please hit like, subscribe, and share. Thank you.